Yeah. Hello, I'm Judith Pentz. I'm a doctor of integrative psychiatry and have seen kids of all ages, as young as 5 to 85. And I want to welcome you to Overwhelmed to Resilience, Thriving Naturally at Midlife and Beyond. It's a masterclass series for women ready to reclaim their energy, peace, and joy. If you're a woman over 40 who often finds yourself giving endlessly to others, at work, at home, in relationships, yet struggle to carve out time for your own well being, this series was created for you. We know how overwhelming life can feel when you're constantly on, carrying the weight of responsibility and expectations. Self care is not just a luxury, it is a lifeline. And yet, it often is the first thing to fall off of our to do list. That's why Overwhelmed to Resilience brings together a powerful group of expert speakers, each offering holistic, integrative tools to support your mental, physical, and your emotional health. And this starts from the first day of the summit. You don't need a total life overhaul to begin healing. You just need to begin with one small intentional step. In this series, you'll discover simple, natural solutions that are practical, doable, and grounded in grace. Even the smallest shift, when done with focus and intention, can spark meaningful change. You'll walk away with ideas that you can apply immediately because you deserve to feel nourished, supported, and resilient, not someday, but right now. So take a deep breath. You're in the right place. Let's begin our journey from overwhelmed to resilience together. So, I want to introduce a woman that I met a few years ago, and we reconnected recently, Dr. Nisha Bhopal. She's a psychiatrist, board certified in psychiatry, sleep medicine, and integrative holistic medicine. Graduating from the University College Cork School of Medicine, she completed her psychiatric residency at Henry Ford Health System and a fellowship in sleep medicine at Harvard Medical School. Founder and director of Pacific Integrative Psychiatry, an online practice in California. She sees patients with a whole person approach to anxiety and sleep disorders, including nutrition, psychotherapy, sleep coaching, and integrative and functional medicine. So, Nishi, Dr. Bhopal, would you like to share anything that what I shared? Is there anything you would like to add to it?
Well, first of all, thank you so much for having me. I'm really honored and delighted to be here and to talk about sleep, which is my favorite topic. And I'll just add to that wonderful introduction that I also have a YouTube channel and online courses for clinicians who want to learn more about sleep because most physicians only get 1 or 2 hours of sleep education, which is wild because all of our patients and clients have to sleep. So,
Right.
but yes, thank you for that.
Yes, and that's really good for people to know because getting that little extra bit makes you a better clinician in so many ways. So thank you for sharing. I wanted to add the reason I wanted to do this summit is that I am a woman of a certain age who has been through most of the challenges that we'll be talking about at various points in time and have found many tools and tricks that have helped me. And so I wanted to have the opportunity to share with other experts what we have found that have been most helpful because each of us have had our own journey into why we wanted to do more integrative in our holistic approach. So let me ask you, Nishi, the women's health challenges that we have, they change actually with each decade. And certainly after the age of 40, there seems to be more and more challenges, especially with, perimenopause, menopausal changes. What are some simple steps that people can do to enhance their mental and physical health that you could share from your experience?
Yeah, absolutely. So, of course, my focus is sleep, and that's really the foundation for good physical and mental health. And I think after 40, starting just to understand and learn more about what are the changes to expect, because I think for many women, especially if you were a quote unquote good sleeper,
Hmm.
suddenly having sleep problems feels really overwhelming and scary. right?
Right.
And so one of the most common challenges that women have with sleep after 40 is sleep disruption. So difficulty staying asleep throughout the night. And I
Right.
apologize, I have a little bit of a cold, and that's because I'm sleep deprived because I've been traveling for the last 2 weeks. So this is a demonstration, right,
Right.
of how foundational and how important sleep is to overall health and well-being. And I know that
Mhm.
when I get more sleep, um, I'm going to get over this infection. So this is just a
Mhm.
little example of how sleep has such a profound impact on our day-to-day lives. So
Mhm.
going back to that idea of psychoeducation, I think understanding that sleep is more likely to be disrupted after the age of 40. And there's various reasons for that.
Mhm.
There's hormonal shifts that contribute to that. There's an
Mhm.
increased risk of other types of sleep disorders like sleep apnea and sleep disordered breathing that we
Mhm.
really need to be on the lookout for as women. And I can share more about that later.
Mhm.
Even the psychosocial challenges of aging have an impact as well, right? So the sandwich generation, taking care of aging parents, children, if you have children, your career, there's all of these stressors that sort of come to a head as we move into our 40s and beyond. So I think
Right.
just having that self-compassion, knowing that, okay, that I'm not alone in this. This is
Mhm.
something that happens and there are tools available. I think that's the first step.
Right. And so thank you. So what would be an obstacle, I think, and you actually just said many of them that might be in to prevent a person to take those first steps? Is it maybe not being aware that there's a new challenge, or are there other factors that might be in interplaying here?
Yeah, so I think when it comes to sleep, there is kind of this general acceptance of being sleep deprived or not getting good quality sleep. Like many of us are walking around with these challenges thinking
Hmm.
that it's normal,
Hmm.
right? Fatigue, being stressed out, being burned out, it's all been normalized in our modern world.
It's
So
true.
I think one of the barriers is not even recognizing that, oh, wait, there's something we can do about this, right?
Hmm.
This can be
Hmm.
addressed. I
Yeah.
don't have to live like this. So one is the lack of awareness of, there are tools available, and I can share more about what those are in a moment.
Hmm.
I think another one, especially for women, is falling into an all or nothing mindset or a caretaking mindset, right? Putting everyone else's needs before our own.
Hmm.
I have a patient that I'm working with who is kind of the, sort of quintessential caretaker in her family. She's in her 40s, she's got kids, she's got a husband, she's got a career. She's working full time, she's taking care of the children, she's doing all the household duties. She doesn't
Hmm.
want to burden anyone by asking for help. And she's so sleep deprived because she's staying up late, catching up on work or catching up on household things, only getting a
Hmm.
few hours of sleep a night, and it's having a significant impact on her physical health, migraines, and other issues are happening.
Hmm.
And so I think that's an illustration where, okay, let's take a step back and start to prioritize our own needs. Because I think the lack of doing that is a big challenge for many women.
I would agree, and recognizing that it is not, it is a necessity. It's not a luxury. It's so, so important. And if you get enough sleep, magic happens the next day. I know that, we all know that, especially as physicians, we've had our share of being sleep deprived through the years, through work. And when you get a good night's sleep, there's a true appreciation for it. So,
Absolutely.
what I'd like to hear some of the favorite things that you would suggest, and how can people practically apply them, into their lives? The women that are struggling, and maybe even, their partners, and other people in their lives.
Yeah, absolutely. So, and I'm just going to add one more barrier
Mhm.
that's going to lead into the next steps, because another barrier is what we were discussing at the beginning, which is that a lot of doctors and medical providers don't have any training in sleep medicine, right? They
Mhm.
might have a very cursory or basic understanding of sleep, but
Mhm.
sleep medicine it's a huge field. I was just at APA, American Psychiatric Association conference this week, and I was
Mhm.
talking to one of my sleep medicine colleagues there, and we were discussing how sleep medicine is not just Ambien and CPAP, right? There's so
Right.
much more to it. Um,
Yes.
so for doctors as well, and therapists and other types of healthcare providers, getting trained in sleep medicine, at least in some of the foundations, is
Mhm.
incredibly important to be able to support your patients and clients, because people are struggling, right? And they need expert help beyond just take a sleeping pill or try some melatonin. or,
Hmm.
referring them out to a place where, maybe they have a months-long wait list to do CBTI
Right.
or something like this. So,
Right.
okay, so shifting into some of the steps that people can take.
Sure.
Number one is understanding that good sleep starts during the day. It's
Hmm.
not just about what happens in the hour or half hour before you go to bed. How you start your morning, how you go through your day sets you up for good quality sleep at night. And I know you
Hmm.
have expertise in Ayurveda, and so this is like a very Ayurvedic principle, right? So having
Sure.
your daily
Right.
routines.
Yes.
So waking up around the same time every day, within
Hmm.
about an hour of the same time. So we don't have to be exact. It doesn't have to be, oh, I got up at 8:02 and I was supposed to get up at 8. It doesn't have to be
Hmm.
like that.
Hmm.
But getting up within an hour of the same time every day helps to reset the circadian rhythm. It resets your clock.
Hmm.
Bright light in the morning is also a way to reset the clock, to modulate your melatonin and cortisol levels,
Hmm.
to help you feel more awake and alert. So
Hmm.
ideally going outside, getting bright sunshine without sunglasses, without a hat on, so you're getting that, bright, intense
Benefit.
light.
Right.
Yeah,
Right.
so that's a great way to start.
Hmm.
The other one is also just being really mindful of how you go through your day and how you regulate your nervous system.
Hmm.
Many of us are like a runaway train during the day, right?
Hmm.
So we're going, 100 miles an hour, and then we want
Right.
to just hit the brakes and, stop and go
Yes.
to sleep.
Go down and
Yeah,
slam and go to sleep. Right.
it does not work that
No,
way,
and
right?
it gets harder with each decade, is what I found. Yes.
Yeah,
Yeah.
absolutely. Because, yeah,
Hmm.
like your to-do list just gets longer and there's, all these other challenges. So, how you can start to regulate your nervous system during the day is very simple practices. So, one of my favorite tools is mindful eating,
Hmm.
because that's something that, we all have to do every day. And so
Hmm.
making sure that you're sitting down to eat, that you're chewing your food really well, maybe even using your non-dominant hand to eat, it helps you slow down.
Right.
That's a way to calm down your nervous system. So a really simple thing. Um, Making sure that you do have a little bit of that wind down runway before you go to bed is important. I'm
Hmm.
actually not a huge fan of bedtime routines because for people who struggle with insomnia or sleep-related anxiety, the
Hmm.
routines can start to actually create a bit more rigidity around
Hmm.
sleep, right?
Hmm.
So I'll hear patients tell me like, "Oh, I have 10 steps in my bedtime routine, but when I'm traveling, I can only do 2 of them and then I can't sleep." We don't want to
Hmm.
fall into that type of mindset, right?
Right.
So allow some flexibility. What I
Hmm.
tell my patients to do is create a bedtime menu. So maybe a list of 7 to 10 things that you know are relaxing for you, and you choose from that menu each night. Maybe
Hmm.
1 or 2 things that you want to do. Could be
Hmm.
reading a book,
Hmm.
taking a bath, doing some light stretching, whatever it is that's relaxing for you, right? So those are some of the first steps that I recommend. And then the next, of course, is prioritizing sleep. So for the person who is chronically sleep deprived and you're just, maybe you don't have insomnia, but you're just not prioritizing sleep, like my patient that I was telling you about,
Right.
doing an experiment for the next, 10 days of maybe allowing a little bit of a longer time in bed so
Hmm.
that you can see what it feels like to get more sleep. So with my
Hmm.
patient, what I recommended to her was, okay, let's give you an 8 hour window in bed instead of the normal, 4 or 5 that she was allowing
Wow.
herself. So let's do an 8 hour window,
Yeah.
and just do that for the next 14 days. And let's just see how that feels.
Hmm.
Again, the caveat, this does not apply to people with insomnia. That's a whole different strategy, which we can get
Right.
into. But
Right.
I'll pause there. So those are some of the tools that I recommend starting with.
Yeah, those are great tools. And I know one thing that I've learned in the last few years, that there's a certain kind of breathing too that can enhance and support, one's dysregulated sleep. And I don't know if you would like to share a little bit about that, but I'm curious to hear more.
Yeah, sure. So, breathing is a fantastic way to regulate the nervous system.
Right.
And, there's lots of different kinds out there. So slow breathing is actually shown to help enhance deep sleep. So slow breathing, meaning slowing your breath down to like 6 breaths an hour, a minute, that type of thing.
Hmm.
Um, but not everyone has to do that. You can do box breathing,
Hmm.
alternate nostril breathing, 4-7-8 breathing, whatever it is that resonates for you.
Mhm.
Oftentimes, when people are struggling with sleep, they also are struggling with anxiety or stress in some form. Not always,
True.
but
Right.
many times that is
Many
the case.
times. You're right.
Yeah.
Yes.
And so sometimes when people with anxiety are doing breathing practices, they start to feel more anxious.
Hmm.
And that's because they're focusing too much on the inhalation.
Hmm.
So what I recommend to anyone, if you have anxiety and you want to try breathing practices, just do a simple practice where you're exhaling for twice as long as your inhalation. And just try that.
That's it. Right.
Yes.
Don't get caught up in the counting and
Yep.
just work with what you're being presented with in that moment.
Exactly. And just do it from the diaphragm. And I recommend doing it during the day.
Hmm.
So a lot of the people that I work with are executives or professionals, and so they may be on Zoom all day. So I'll
Hmm.
tell them just do it during a Zoom meeting. No one even needs to know, right? You can just sit back and
Right.
do it, or do it
Understand.
after each meeting as a checkpoint. That's a
Hmm.
good way to regulate your nervous system. And it
Hmm.
also reduces the idea of sleep effort.
Hmm.
Because sometimes when people have sleep anxiety or insomnia, they
Hmm.
start doing these practices hoping it's going to help them fall asleep.
Right.
And that association or that effort actually creates more anxiety, right? So we want to disconnect it
Yeah,
from
trim that
that.
expectation of
Yes.
happening. Yeah. No, that's a good idea. I like that a lot. Anything else you would like to add around that? Other, because I have another question, that's more about well, I'll just share caffeine intake. I find that's really still not on people's radar often, nor understanding its impact, the quantity and, how late in the day they might consume, that type of thing.
Yeah, that's a great question.
Hmm.
So the way that caffeine works is that it blocks a neurotransmitter called adenosine.
Hmm.
So adenosine is a neurotransmitter that builds up during the day and it makes us feel sleepy at night. And what caffeine does, the caffeine molecule looks very similar to the adenosine molecule.
Hmm.
So it binds to the adenosine receptor. So it knocks the adenosine out, it binds to the receptor. So now the
Hmm.
adenosine can't tell your brain that you're sleepy.
Hmm.
So this is why you see the lineup at Starbucks around the corner at 2 p.m., right? Because adenosine is starting to build up. So people want that caffeine hit to,
Hmm.
to reduce that adenosine effect.
Right.
However, the half-life of caffeine is anywhere from like 6 to 12 hours, depending on a person's metabolism. For someone
Hmm.
who's a slower metabolizer of caffeine, it could stay in their system for that long. So
Hmm.
what that means is if you have, let's say, a cup of coffee can be about like 60 to 80 milligrams of caffeine. Let's
Right.
say you have 80 milligrams of caffeine at 2 p.m. and
Hmm.
the half-life for you is, let's just say it's 6 hours, right? So 6 hours later, you still have half of that in your system. So 30 milligrams of caffeine is still in
Hmm.
your system at 8 p.m., right?
Hmm.
And so that is going to have an impact on your ability to fall asleep and stay asleep because it's not allowing adenosine to do its thing. And
Right.
it's going to cause disrupted sleep architecture. You're going to
Hmm.
feel more tired, not as rested. So then what
Hmm.
happens? You have more caffeine the next day because you're so tired, right?
Right.
So it becomes a
Vicious.
vicious cycle.
Right. Yeah. Okay. Um, what about somebody who may have some challenges with what's known as adrenal fatigue? And is that something you would look at and address with them? And because no amount of caffeine really will help that.
Yeah. So in those types of cases where someone's struggling with, a lot of like adrenal fatigue type symptoms or chronic fatigue symptoms, we
Mm-hmm.
need to look under the hood to see what is going on here, right?
Hmm.
What is contributing to this before we add on, a stimulant medication or other things that are done in traditional Western
Right.
medicine,
Right.
conventional medicine.
Right.
Um, so some of the things from a sleep perspective that I like to look at are, okay, let's go back to the drawing board and let's just make sure you're getting enough sleep for your baseline sleep needs. Okay, so for someone who, most adults need somewhere between 7 to 9 hours. So if you're a 9 hour sleeper, but you're getting 7 hours, which is technically considered normal, but
Hmm.
for you, if you need nine, that's 2 hours of sleep deprivation per night, right?
Right.
So that's kind of step one. We also like to look at labs. So in sleep medicine, some of the relevant micronutrients to look at are
Hmm.
ferritin and iron.
Hmm.
Um, and when I tell doctors this, they're always so surprised. They're like, what? That's an optimal ferritin level? So
Right.
a normal ferritin level is usually around like 20 and
Hmm.
up. But for sleep, we like that number to be 75 or even 100
Hmm.
is considered optimal. And
Hmm.
when it's less than that, so ferritin is a marker of iron stores in the central nervous system,
Right.
anyone
Yeah.
who's not familiar.
Right.
Um, so when the ferritin is less than that, it can cause chronic fatigue, restless sleep,
Hmm.
restless leg syndrome, all
Hmm.
kinds of sleep disruptions. And so
Hmm.
I've seen this in my practice when women, especially, but men can have low ferritin as well.
Hmm.
When we start to improve their ferritin levels with diet and supplementation, their energy levels and their sleep quality starts to improve. Super
Hmm.
simple thing. And then, of course, I'm always thinking about sleep apnea and sleep disordered breathing,
Hmm.
especially in women after the age of 40, but even before.
Hmm.
Sleep apnea looks very different. So in men, we often think of the classic symptoms of loud snoring, they're waking up gasping at night, their spouse is kind of like nudging, elbowing them, like, okay,
Right.
roll
Yeah.
over,
Uh-huh.
because you can't sleep because of the noisy breathing.
Hmm.
But in women, sleep apnea doesn't necessarily look like that.
Hmm.
It can look like chronic fatigue, fibromyalgia,
Hmm.
depression,
Hmm.
insomnia. It shows up in a very subtle way in women in many cases. Sometimes they do have the classic symptoms as well.
Hmm.
Um, so like in my practice in the last few months, I had about like 4 women who were referred to me for treatment-resistant insomnia by their psychiatrists. They were trying trazodone and Ambien and all the things, and it wasn't improving.
Hmm.
And maybe they had done a bit of CBTI, which is cognitive behavioral therapy for insomnia, wasn't
Hmm.
getting better. So I do a home sleep test, which is a multi-night sleep test. So we do like 30 nights of home sleep testing, which is
Hmm.
pretty cool compared to the standard 1 or 2 nights. And all of them had moderate to severe sleep apnea, but they didn't have the classic symptoms. They had insomnia symptoms, depression, um,
Right.
right? Fatigue, that kind of thing. So these are all the kinds of things that I would look into for people who are struggling with adrenal fatigue type symptoms or chronic fatigue.
That's wonderful. I actually check for all those variables that you just mentioned, those labs, and often will send people, regardless of their body type, to get screened, because I know one that the sleep home test is available now, and it's much more available and easy to use with so much more information that's shared as a result. So thank you for sharing that. That's really, really important. Do you have a favorite supplement regimen that you prefer over medication? Because I know that your approach is holistic and integrative. And I know when people do that in their practice, many, including colleagues, can find it inspiring. You could share a little bit about your favorites. And then actually, and we can come back to this, is what drew you to this specific path and your passion behind it. All right.
Wonderful. Yeah. So I do have some favorite supplements. And
Yeah.
I'll just preface this by saying that supplements are not a replacement or a substitute for, healthy sleep promoting behaviors or addressing some of the underlying causes that we just talked about.
Hmm.
There is a role for them. And I
Hmm.
kind of think about supplements in 3 different buckets.
Hmm.
So are we using it for prevention? So for example, using folate during pregnancy would be an example of that. Are we
Hmm.
using it for repletion? So for
Hmm.
example, if they have low iron or low ferritin, maybe we're repleting iron levels.
Hmm.
Or are we using it as a therapeutic? So that's where we're using it to maybe help with, hyperarousal, nervous system, activation,
Hmm.
anxiety and stress. So those are the 3 buckets that I think of.
Okay.
So in the repletion strategy, in that bucket, that's where I might be using vitamin D, vitamin B12, iron to replete those types of micronutrients.
Wonderful.
But in the therapeutic strategy, in that bucket, some of my go-tos would be things like L-theanine,
Hmm.
and there is data for that
Hmm.
um, in sleep, and it's especially helpful for people who have ADHD and
Hmm.
sleep. There is data looking at it in ADHD in children. I don't treat kids, but I do use it in my adult patients.
Hmm.
Um, Another one is ashwagandha. Uh,
Oh,
so
yes.
right, so you use that one a lot too, I'm sure.
Yeah, I do.
And so that's an adaptogen, so that's helpful for my patients with chronic
Hmm.
burnout, stress, that type of situation.
Hmm.
Another one is I do use magnesium.
Hmm.
More in the repletion bucket, though. I think a lot of people are taking it as a therapeutic,
Right.
hoping that, okay, if I take magnesium, it's going to help me sleep.
Hmm.
It doesn't quite work that way. And actually, the data on it for sleep is not that robust.
Hmm.
But so many of us are deficient or have insufficiency of magnesium,
Right.
that it's a pretty, critical nutrient that I do recommend.
Yes.
Um, Sometimes I will use melatonin when it's clinically indicated.
Hmm.
It's actually not indicated for chronic insomnia. So
Hmm.
the American Academy of Sleep Medicine does not recommend its use for chronic insomnia.
Hmm.
But it is very useful for people who have circadian rhythm misalignments,
Hmm.
um, for people over the age of 55,
Hmm.
because melatonin secretion decreases with age.
Right.
It is used in other countries like Australia and the UK in its extended release form, 2 milligrams for people over the age of 55.
Hmm.
There are certain medications that can um, inhibit melatonin production as well, like fluoxetine, or Prozac, which, as
Hmm.
psychiatrists, we see patients who take
Right.
that medication. So I might use it for repletion in those patients. Yeah,
Okay.
so those are some of my main go-tos. There's other ones I like as well, like lavender has some
Hmm.
research behind it.
Hmm.
So that's a great one. Um, Sometimes I'll use blends as well. So, a blend that has like ashwagandha and L-theanine, um,
Hmm.
and passion flower and hops. There is data for those as well. Yeah.
That's wonderful. Do you use valerian very much?
I don't use
Hmm.
it that much.
Hmm.
Once in a while I'll use it if it's in a blend, but
Hmm.
it's not one of my go-tos.
Yes. Okay. So I wanted to ask about, well, why don't you share a little bit about your path, and then I had a couple of more questions.
Sure. So yeah, so how did I get into sleep medicine? Well, I was always someone who kind of struggled with sleep myself. There was, some personal motivations to explore
Sure.
sleep medicine,
Right.
more because I was on the fatigued and sleepy side, not so much the insomnia side, but just kind
Hmm.
of, struggling with sleepiness. And I was more sleepy than my peers. And then, of course, med school and residency were brutal because it involves so much sleep deprivation, and I just
Right.
felt like I couldn't get a handle on it.
Hmm.
Then when I was in my psych residency, so many of our patients struggle with sleep. There isn't a psychiatric disorder that isn't associated with, sleep
Right. Problem.
issues, right?
Right. Right.
So I wanted to learn more about it, and one of my senior residents was going into a sleep fellowship. And
Oh, yes.
I was at Henry Ford Hospital, which
Hmm.
is they have a world-renowned sleep medicine department there.
Hmm.
And so I started doing rotations with them, and I just loved it. I
Hmm.
just thought it was so fascinating. For me, sleep medicine is it's kind of like space exploration. It's one of those fields of medicine that's like there's just so much that's
So much.
unknown about it.
Uh-huh. Uh-huh.
And it blends biology, psychology, dreams, and like there's just so many interesting aspects to it. So I just loved it.
Hmm.
And throughout this whole time, I was exploring my own, wellness with yoga, meditation,
Hmm.
being interested in Ayurveda and these types of things. And so after my fellowship, I did more coursework in those areas. And so
Hmm.
that's how I got into integrative sleep medicine.
Okay, that's wonderful because I know when we have a personal interest for our own well-being, we can then translate it much more effectively and actually with much more passion, with the people that we're serving in different ways. So, and that's certainly coming through with what you're sharing today. I wanted to ask a little bit about food and the timing of eating, that type of thing, because I know that too can be a huge issue in terms of the types of food and the impact on sleep.
Wonderful. Yes. So when it comes to food and sleep, it's not just about what we eat, but also when we eat.
Hmm.
So what I recommend to people is before you even try, changing your diet or, incorporating some of the foods that I'll talk about in a moment,
Hmm.
just focus on the timing of your meals. And again, I know you do a lot, you have a large focus on that as well with the
Hmm.
daily routines. So what I recommend is keeping lunch as your main anchor for the
Hmm.
day.
Hmm.
A lot of my folks that I work with skip lunch or they have their lunch on the go. And so, I
Right,
encourage them to just take some time, even if it's 15 minutes. You don't have to take a 2 hour European lunch, but
right.
take some time to sit down, do the mindful eating that we discussed, and make that your circadian anchor, because that helps to regulate your whole circadian rhythm through the day, which impacts your sleep wake cycles.
Hmm.
Doing that has such an impact. So I was working with this patient who she's had chronic insomnia since the age of like 16 or 17,
Wow. Uh-huh.
and has been on, basically every sleeping pill under the sun, right? Like, and whenever a new one comes out, her psychiatrist would try that with her.
Hmm.
And she was skipping meals and, busy professional, very typical sort of thing, on the go. And so I encourage her, let's just start by regulating your meal times.
Hmm.
Because even some of the behavioral sleep interventions felt too overwhelming for her with the anxiety. So, okay, let's focus on your meal time. So I had her do her lunch at a scheduled time every day, then a
Hmm.
light dinner. And, within a week or two, she was like, oh, I'm starting to feel more energy during the day. I feel like
Hmm.
my sleep cycle is a little bit more regulated. Of course, it wasn't, the cure for all her problems,
Sure, but there was a
but there
difference.
was a difference.
Hmm.
So I do recommend that to people.
Hmm.
Um, for, the morning, many of us don't feel hungry first thing in the morning,
Hmm.
but after you do your morning routine, so if you have your morning yoga practice or something,
Hmm.
um, make sure you hydrate. So hydration with water is super important first thing in the morning. And then you
Hmm.
can have a little bit of something light if you want in the morning, some fruit or something like this, or something
Hmm.
with some protein and fiber.
Hmm.
Um, so those are kind of like the anchors, and just try to do that within about the same time each day,
Hmm.
weekends included. That's a key point.
Right, that's can
Yes,
throw people off very quickly.
yes. Now, in terms of what to eat, so I know these days there's a lot of emphasis on protein, right? Like we're hearing about
Correct.
protein all over the place. And I
Hmm.
think there's not enough emphasis on fiber. And there is data showing that when people consume more fiber in their diet, they're more likely to have more deep sleep.
Hmm.
People who eat less fiber and more refined sugars are shown to have less deep sleep and more disrupted sleep. So shift to thinking about how to get more fiber into your meals. Like, I'm not a fan of deprivation of like, oh my God, I have to like not eat that,
Hmm.
brownie or whatever, because it's not part of like, no, I don't want to take anything away, but what can you add in to get
Hmm.
more fiber? Women need about 25 grams of fiber per day.
Hmm.
And the average person in North America is getting about 15 grams, right? So definitely not enough.
Right.
So I do recommend incorporating some sort of fiber into each meal,
Hmm.
ideally from whole foods, right? From plants. So, fruits, vegetables, lentils, legumes, those types of things,
Hmm.
rather than thinking about a fiber supplement, because
Right.
yeah, just getting that whole food diet has an
Hmm.
impact as well.
Right.
Um, so those are the main things I would think about. And then I would also just consider your sleep disruptors. We talked about caffeine. So having a cutoff time after 12 p.m. is ideal for most people.
Hmm.
And then look at other things that might be disrupting. So things like alcohol, um,
Right.
and then having like, very sugary, refined sugar foods in the evening can have an impact. And the last thing I'll just say about I mean, I could keep going on, but the last thing
Sure.
I'll say about this is think about how evening food affects your sleep. So for some people, like for my husband, for example, if he doesn't eat within an hour or so of going to bed, if he doesn't have something,
Hmm.
if there's too much of a fasting period, he does not sleep as well. And
Hmm.
I'm the opposite.
Hmm.
I need a few hours of fasting before I go to sleep, and I sleep better when I'm
Hmm.
in a fasted state. So
Hmm.
everyone is different. So tune into your unique needs, your
Hmm.
physiology, and see what works best for you. So if you're someone who might have a lot of nighttime awakenings, maybe you even wake up feeling a little bit anxious or panicky,
Hmm.
sometimes that can be a sign of a blood sugar drop at night.
Hmm.
So having a high fiber snack about an hour before you go to bed can help stabilize that effect. So high fiber snack would be, something like maybe some fruits and nut butter, or,
All right.
a bit of yogurt with, some veggies or something like this.
Hmm.
Um,
So
but
not a full meal.
not a whole meal, but
Hmm.
finishing your main meal 3 hours before bed, like your dinner, at least 3 hours before bed is a good recommendation for most people. And then if
Hmm.
you need that stabilizing effect, the high fiber snack an hour before can be helpful.
Mhm. Yes. And I've seen that, especially I work with kids, and I've seen that with kids, especially in their growth phase, where they are still hungry after a decent meal and they'll have a snack before they go to bed. So, and they sleep just fine, you know. So I had a couple other things to ask, but wanted to check in. Is there anything that we haven't touched on yet today that you would like to share?
Yeah, so, I think the big one that I want to emphasize is that sleep is highly treatable, right?
Hmm.
So if you're doing all of the things, you might be listening going, yeah, I do all of that already and I still can't sleep.
Mhm.
There is help available. So don't hesitate to get a referral to a sleep doctor or a behavioral sleep specialist. Now that we have online services, there's so much telemedicine available. It's much more accessible than it used to be. Um,
Mhm.
and if you don't know where to go, you can go to the Society for Behavioral Sleep Medicine,
Mhm.
and you can find a directory there, or ask your primary care doctor. There's some wonderful sleep clinics online as well. So
Mhm.
whether you're struggling with disrupted sleep, maybe you need a sleep study, which can be done at home, or if you have chronic insomnia, the treatments for that are CBTI or cognitive behavioral therapy for insomnia, which in
Mhm.
my practice we blend with ACT, which is acceptance and commitment therapy. It's a more gentle, holistic approach to it. Um,
Right.
there's lots of modalities available, so don't hesitate to ask for help.
Okay. So I wanted to ask if you could write the name of that association in the chat, and then wanted to talk a little bit about exercise because I know exercise has its value, but the timing is also important. So I'll give you a minute to write that in, or actually, you can do that when I'm wrapping up. Why don't we do that? Yes.
Sure.
So let's talk about exercise.
Okay, great. And I just
Oh,
put the
oh,
link
you
to that
did.
in
All
the
right.
chat
Thank
there.
you.
Yes.
Yes.
Excuse me. Okay. So when it comes to exercise, exercise is so important for everything, right?
Yes, it
For,
is.
for physical health, for mental health, and of course for sleep. Um,
Mhm.
the more physical activity you get during the day, the more it builds up your sleep drive. Sleep
Mhm.
drive is like hunger, right? So if you sit down for a meal and you're not that hungry, you're not going to eat very much.
Mhm.
Um, so sleep hunger, sleep drive is like that. If you're not that sleepy, you're not going to sleep very much when you go to bed. So exercise helps to increase that sleep drive. Now, in terms of the type of exercise, what I recommend to my patients is do what you enjoy.
Mhm.
Like if it feels like a chore, if it's something you want to avoid, you hate going to the gym and you hate running on the treadmill, don't do
Mhm.
that. Do
Right.
something that, brings you joy that you're going to be consistent with,
Mhm.
whatever that is for you, whether it's walking or dancing,
Pickleball.
pickleball, whatever, like going to the
Yeah.
beach, whatever it is.
Yeah.
Um, Now, in terms of timing, so there are studies that show um, that getting vigorous exercise within an hour of going to bed has a negative impact on sleep. So it can make it harder to fall asleep and stay asleep.
Mhm.
Vigorous exercise means that it's hard to carry on a conversation with somebody else. So
Mhm.
that's how you know it's vigorous for you, right?
Mhm.
So I recommend avoiding vigorous exercise an hour before going to bed because it increases your core body temperature
Mhm.
and you need a cooler core body temperature in order to fall asleep and stay
Sleep.
asleep.
Right. Okay.
But if it's not vigorous, even up until the evening, it's okay. And just see how it impacts you. So
Mhm.
I'm an evening exerciser. Like I prefer to exercise in the evening. That's just my circadian rhythm.
Mhm.
My workout's not as good if I do it in the morning.
Mhm.
But I have friends and colleagues who swear by their morning workouts and it's not as good in the evening. So you have
Yeah.
to tailor it to you, but avoid the vigorous exercise an hour before you go to bed. The
Mhm.
other thing I do recommend to my patients is to stay active during the day. So even if you're not working out, you know, throughout the whole day,
Mhm.
between meetings, get up, maybe
Mhm.
do a few squats or a few jumping jacks or go up and down the stairs or whatever you have available to you and just
Mhm.
keep moving because
Mhm.
we're so sedentary in our modern day and age, right?
So,
Um,
yeah.
yes, even if it's going outside and going for a walk, that's ideal to go outside, get the sunshine, that's good for your circadian rhythm, get
Right.
movement. But exercise is one of the best things that you can do for your sleep and your overall health.
Okay. So I totally agree with you. And I know that there's a big push now for weight training and a lot of protein, loading, that type of thing, creatinine and all that. Do you see any challenges with people developing sleep problems from too much exercise? I'm not saying they are exercising too much, but a certain style of exercise. Let me put it that way.
Yeah, that's a really interesting question. So, I think about it from a few different angles. So one is, yeah, is it like the actual form of exercise or the supplements that they're taking?
Hmm.
Nowadays, with wearables like the Aura Ring, which I have, or other trackers, we can
Hmm.
actually see, what the impact is for that person.
Hmm.
So I'll sometimes have patients just track and see, how is this affecting you? Because everyone is so different. But
Hmm.
the other thing that I think about is it just too stimulating for you at night? So,
Mhm.
for example, I have a patient who goes to the gym at like 10 p.m.
Wow.
and um yes, maybe she's not doing vigorous exercise, right?
Right.
But
Mm.
it's stimulating. There's people there, you're interacting, the lights are on really
Lights are
bright.
very bright.
You're driving there, you're driving back, like the whole
Yeah.
thing is just so
Yeah.
stimulating. So
Uh-huh.
it's not just about the exercise, but also the whole package of what's
Right.
happening.
Yeah. Yeah. So that's really interesting that you're sharing that because the 24-hour gym is a thing now, right? But there are also a lot of people who work shifts. We haven't actually talked much about that. So it's something you would like to talk about with people who are, challenged. I know my son-in-law is just getting off from doing night shift again, and it should be his last time in this lifetime, I hope. But it's been a challenge. I can really see the fatigue in him sometimes, making that transition from week to week. And again, and it's true for the women that I've worked with at night. And in fact, one of the work things that I do at my university is I see the staff from the hospital. And I've actually had to write for people, to recommend that they get off of night shift because the mental health has had such an adverse impact. And as soon as we make the shift, they're like almost normal human beings again.
Yep. That's exactly right. And I've done the same for my patients as well, especially
Mhm,
my nurses. I have quite a few
mhm,
patients who are nurses and they're doing night shifts. And yeah, I've
mhm.
written for them to shift back to days because of the impact it was having on their mental health.
Right.
Um, and it's not just a personal health issue, it's also a public safety issue. Um,
Right.
right? Because you think about people who are sleep deprived or coming off a shift and they're driving, um,
Hmm.
higher
Right.
risk of motor vehicle accidents. Or I just had Dr. Allison Cole, she's a sleep doctor on my YouTube channel, and
Hmm.
she speaks a lot about shift work. She herself struggled with burnout during the pandemic, working in the ICU, doing shifts. She changed her career because of the impact it was having on her,
Hmm.
the
Well-being.
way that she practices. Yeah.
Right.
So, for anyone who wants to do a deeper dive into shift work, check out that video because she gives us a whole masterclass on shift work on that video.
Hmm.
But she also highlighted how how these are public safety concerns. So like Chernobyl, Exxon Valdez,
Hmm.
Challenger, these disasters that many of us you know ex- lived through or witnessed
Hmm.
and know about were caused because of sleep deprivation secondary to shift work.
Really? I don't think I knew that. That's really important.
Yeah.
Yeah. Hmm. So, there's a lot of awareness of safety issues in the workplace more and more. Here, in fact, in New Mexico, they're trying to create safety around heat exposure. And I know that temperature matters, in terms of being able to sleep at night, but also what you're exposed to throughout the day. So, anything what you would like to add around that, and then we can draw a close to what we've been chatting about, which has been great here, I have to say.
Wonderful. Yeah, I know we could just keep on going. Sleep is
Yeah.
so fascinating. There's so many layers. So when it comes to
Yes.
temperature, we do have a reduction in core body temperature by, 1 to 2 degrees Fahrenheit,
Hmm.
in order to fall asleep and stay asleep. So
Hmm.
how you can promote that is by modulating the temperature in your ambient environment.
Hmm.
So, turning the thermostat down. Well, I mean, if you're in a hot place, then you might be doing, you might be turning your air conditioning up or using other strategies, but um, reducing the temperature of the room to about, like for most people, somewhere between like 60 to 70 degrees Fahrenheit, um,
Hmm.
or, like 17 to 20 degrees Celsius,
Hmm.
is what's recommended according to your personal comfort too, right? If the room's it feels freezing to you, then that's not going to be helpful, but so
Right.
take into account your personal comfort. Um, what I do is I actually I'm in the Bay Area, so I have the luxury of being able to open the windows. Like if you're in Arizona or something, that's different. But
Right.
I open up the windows in my bedroom about an hour or two before I go to bed, so it airs out and we get that nice fresh air, nice and cool. And then I shut them
Hmm.
when I go to bed. Um,
Hmm.
Also, just being mindful of the type of bedding and sheets that you use
Hmm.
has an impact. So using more like natural fibers, cotton, linen,
Hmm.
staying away from synthetics that because synthetics trap the heat. So
Hmm.
all of these kinds of things have an impact. And then in the evening, it might sound counterintuitive, but having a warm shower or warm bath in the evening,
Mhm.
about an hour or so before you go to bed, it actually
Mhm.
helps to reduce your core body temperature
Mhm.
because the blood goes to your extremities, goes to your
Jesus, right.
skin, you're
Mhm.
offloading that heat, and then your
Right.
core body temperature decreases. So that's helpful.
Drops. Yeah. Okay. Well, so instead of a cold shower, is what I'm hearing. Yes. Okay.
Yeah.
All right. Well, I want to ask you to talk about your free gift that you're offering, and we'll do a little closure. All right.
Okay, great. So I have two free gifts. One is a webinar on three sleep myths and how to get your best sleep. Uh,
Mm-hmm.
so that's a free webinar that's available. I think you'll share the link to that. So I encourage everyone to watch that, and you might learn some things that we didn't even discuss today. So I highly recommend checking that out.
Okay.
The second free gift that I have is a free melatonin brand guide for clinicians.
Mm-hmm.
So for the doctors, therapists, or health coaches, if you're
Mm-hmm.
working with patients and clients, and they ask you about melatonin supplements. Not all melatonin supplements are made equal. Some of them are better quality than others. So you can
Mm-hmm.
check out the free brand guide for information on that.
Wonderful. And I look forward to being able to read both and watch both because they really sound pretty fascinating to me. So I want to thank you so much, Dr. Bhopal, for sharing your wisdom and your knowledge today, and your time. And to all the listeners, if there's any questions that you're having, there'll be ways we're going to have the opportunities for you to share through email and also looking at a Facebook group possibly to add to the experience here. And let me just share, we've got other interviews that are happening with this masterclass series, and we will have a couple people talking about nutrients and nutrition, the importance for mental well-being, lifestyle changes that are personalized for you from an Ayurvedic perspective to reduce stress, sleep, we're talking about today. And then we have one person who's talking about the rainbow of phytonutrients and the color of food and how it can help nourish you and make eating and making choices more fun. We also have a person speaking about CBD and mental health, and compassionate caregiving as we age is another topic, and medical qigong, some tools to help moderate and modulate stress. So thank you so much for your time today. I look forward to hearing back from all of you. And Dr. Bhopal, thank you so much for